In structured approach, we have this mnemonic of EII, wherein we evaluate, identify, and intervene. These are the things that we need to follow. This is in specific sequence. So in evaluation, we have steps of evaluation which include initial impression, which is also called as general assessment, then primary assessment, subsequently we do secondary assessment, and then the tertiary assessment, which is wherein we do the diagnostic tests. So when we are doing initial impression, we are initially not touching the baby or a child. As a child comes into the emergency room or the casualty, we just by our look, without touching the child, we should be able to understand which kind of vital system might be hampered. That helps us to approach toward that specific system management. So first response to a pediatric emergency of any cause is a systematic or rapid general assessment of the scene and the child to identify immediate threats to the child and care providers and others. So this is a sentence from Nelson, which actually means that we have to have a structured approach as far as managing the child is concerned. Now, firstly, what is an initial impression? Initial impression, like I was saying, has to be done based on the appearance of the child. In a sense, how you look at the child. Without touching the child, we should be able to come out with certain conclusions or deductions just by looking at the child. And that our deduction should be based on our assessment of all the three systems, which are CNS, respiratory system, and cardiovascular system. Herein, it has been classified as appearance, breathing, and color. Appearance actually represents CNS, breathing represents obviously the respiratory system, color represents obviously the cardiovascular system, but then there can be overlap of many things. The color hampering can be because of impairment of respiratory system, even in the CNS system. There can be overlap. So we need to have a visual as well as auditory impression of how the sick child is based on these three things. This is basically called as pediatric assessment triangle, wherein we do the general assessment or initial impression of the things. Within this appearance part, we have to see multiple things to have a structured, standardized, rational approach. What are things that we need to see, especially to identify the CNS impairment? So there is a mnemonic for this, which is called as TICKLES. First is T. T stands for tone, wherein we are looking at the general posture of the child without touching the child. If the child is in flex posture,